Loyal migrants. Good morning, Guam. It's Friday. Containing COVID. 647. It's a big, huge show for you. As always, real information, real time. And let's get Dr. Felix Cabrera from the Physicians Advisory Council for the governor. Good morning, doctor.
Good morning, Chris. Good morning, Sabrina.
Good morning. Not sure if I want to talk to you, but
right.
Listen.
I feel that way all the time.
I mean, you know, the governor wants you to be wrong.
Oh, gosh, yes. I want myself to be wrong so much.
But, Doc, let's just get very serious business. I know the governor teased a presentation that you're doing. Can you tell us what we can expect about new trajectories in this presentation, Doc?
Sure. You know, we've been, working tirelessly trying to come up with a model that gives us a good timeline of what we can do to work on and what are the things that we need to expect in the coming weeks to months. So it just comes into the one, two basic questions is, when might we see a peak and when might that peak be? And so it seems like a simple question, but that's, again, we're trying to predict the future here. And whatever we say doesn't necessarily become our fate, but it's something that gives us a direction to turn and in terms of what we need to do to prepare and our readiness for that. So basically what we're going to be going over this afternoon is getting a better understanding of what the scale is of this enemy, this invisible enemy that we're dealing with here. I like to preface by always saying that, especially this week, is that, the initial presentation that was done over a week ago was about trying to understand that first grenade that was thrown to us. We were trying to basically give us a chance to first locate where the grenade was and then what to do, either cover it or run away from it, put the pin in it, what have you. And, to all of Guam's credit, we dodged that first grenade. And I think that's a tremendous accomplishment by the entire island, but that's just the first grenade. What we're talking about now is the potential outlook of the entire war. So that's what we wanted to go over today and be able to get it out to the public so that they can have a better understanding.
How are you developing the models that you're going to be presenting, Doc?
Sure. What we did was we used some pretty classic epidemiologic models that are used, throughout the several decades. And but with those models, of course, those equations are just equations, and they don't mean much until you put in, reliable data into it and make adjustments that are reliable, that are specific to the area that you're trying to look at. So you're not just looking at these equations; you're also looking at the population that it's speaking about, and then also the infrastructure that helps take care of that population. So you have to take all three into account very, very, very seriously and very heavily. And with that, there's still going to be a number of assumptions that are made and estimates, which are, again, educated guesses based on the knowledge that we have. I listened to part of Dr. Peter Lombard's interview just earlier, and and everything he said was pretty spot on overall. And we were dealing with a small amount of data here, and when you deal with that much, the confidence in what you have in your projections gets shaky overall. But it's better than nothing, and it gives us something to act on right now, and more so than ever, and we've seen in every other country and state and territory, is that the more you do early, the less that actually becomes your fate.
Doc, what other agencies are assisting you in compiling this data and kind of sifting through it?
Yeah, so I'm just like Dr. Peter Lombard. I'm not a statistician and I'm not an epidemiologist, but and I'm definitely not as smart as he is. But the reality is that doing things like this important, you have to have peer review. You have to have people that can look at your work and give you feedback and be able to poke holes, and you have to be willing to have them poke holes into what you're doing, because it's not about pride or ego. It's about the people's lives here. So we've actually invited Peter Lombard to help us with this process, and basically his job is to do the complete opposite of what we're doing. in this sense. In other words, look at the other side. Look at our six. Have our six. Look at what we're missing, and he's been a tremendous help in that manner. But again, just like me, we're physicians in the community that have a basic knowledge in a lot of these models. We took these type of courses in undergrad and med school. And then it continues even to residency and now, because we constantly look at medical studies that use a lot of statistics. So we keep up our practice in it in some way. But that being said, we went to some of the more real experts in this, and they are epidemiologists on the island, in particular with CDC representatives here, and then also with our public health epidemiologists, and that have looked at our models as well and helped us develop and adjust it into ways that might make it more meaningful. We also so that was part of even just the building of the model. So it wasn't just myself and the physician advisory group. We really went outside, even just with the sources locally. Now nationally, the reason why what pushed this us to be able to feel confident to share this with the public is that we got independent confirmation, or I should say, independent corroboration, and this came from the U.S. Army Corps of Engineer and the U.S. Army themselves, who did an independent study on what Guam's trajectory might look like, and basically asked the one question is, when will Guam be overwhelmed, potentially, and what potentially are the trigger points that we need to do to start making decisions. And it was a report that was just as sobering as ours. It meant that we weren't exactly just doing things completely blindly and incorrectly, that we were on the right track here. So we think that with our local knowledge that adjusted our models better, we think that we have a pretty good understanding of what the trajectory is today.
You said you got input from the U.S. Army Corps of Engineers in your numbers. Were they alarmed to see the amount of cases that we currently have, just considering our population?
So just to clarify, so they didn't look at our numbers at all, okay. And what they did their studies completely independently.
Right.
I see.
Yeah, and so which is actually even more important to say that, because they weren't influenced by what we had and what the numbers that we're giving. So they came up with a lot of that on their own. They did make more assumptions because they don't know the local nuances, so to speak. And but even with their assumptions, they were pretty close. And yeah, they in some of their worst case scenarios, it seemed even more aggressive in some ways than ours.
Mm-hmm. You said that this is going to be an outlook of the potential war. How far of an outlook are we talking about? I'm talking about like 2 weeks, or
Well, let me just quote Dr. Fauci from who's head of the Institute of Allergy and Infectious Disease for the country, and who's been the face of this fight here in the country. He thinks that there's a chance that this may push on into 2021.
Oh my goodness!
I don't want to talk to you anymore, Doc.
This is why we don't want to talk to you.
But here's the thing. One can also say that we've been dealing with the flu for centuries, right?
Mm-hmm.
And so the question is just on what level are we going to deal with coronavirus? Do we want to deal with it in the level that we're dealing with it now, or are we going to comply and do it to squash it down to the point where it's manageable, to the sense where we can get to an effective vaccine? Again, probably it's not until 1 year from now, and that's an accelerated process to make it 1 year from now, and then to the point where it's manageable, and so that's the key part there. But it's not going to go away completely, and we have to start accepting that reality, that we will get to a point that we'll have control no matter what. It's just that how much of a price do we want to pay to get to that control? Right. And if we push this out, we push it out, squash it down, then all of a sudden it's not a big of a monster as it initially it looks like, and what it actually is in places like Italy, Spain, France, and New York City. And so that's our main goal. And right now we have to really look seriously at what's going on in those countries, and cities, because that could very much be our fate.
Doc, just two questions, because I know you got to go. Who's going to be presenting with you, and why is it important for everybody to tune in and watch this presentation that you're going to be giving?
Yeah, because this is the first time that we can, again, everybody has to really know what they're up against, and potentially up against. And, just like how you want to tune in, and if there's a Category 5 super typhoon heading toward Guam, you'd want to tune into this press conference, because we're giving you our very first forecast that looks out from there. And on top of that, so Dr. Michael Cruz, who's our state surgeon and who's leading this COVID unified response effort, we'll be speaking as well. And then, but not only tell us, we're not only going to just tell you what our forecast is. We're going to tell you what what we've done over, especially the past week, especially after we saw these numbers for the first time. We've been working extremely hard getting things moving, because every minute counts. Obviously every day counts. And so also going to be presenting is Dr. Luis Cruz, who's a family physician here on the island, and also a major in the Guard. And so he's been activated and is part of our state surgeon cell. So between the three of us, we'll be presenting this, and he's going to primarily focus on what our initial contingency plans are. And that's very important, because the public needs to know that here we're showing you the problem, but now we're also showing you the first steps in part of the solution, if that ever came to fruition, if that trajectory ever became true. But more so than ever, it means that the more we act now, and if our numbers are wrong, and if they end up not reaching that trajectory, that's because Guam did that. Guam as a community did that, and it will be Guam's victory if those numbers don't pan out.
Okay, Doc. Well, I guess
Thanks.
we'll see you later at 1.
1 o'clock.
I just feel like I'm going to the doctor later, and the prognosis is bleak.
Yeah.
Right?
Make sure you shower before you go to the doctor.
Yeah, make sure you wash your hands. Thank you, doctor.
We'll see you at 1, Doc. Thank you so much.
Thank you. Have a good morning.
There you go. Yeah, heavy work, and and talking with Dr. Cabrera offline, I was able to touch base with him last night. This presentation is going to be very serious.
Yeah, so we are going to be streaming that press conference 1 o'clock on our Facebook page, and we encourage everybody to please watch it so that you have the latest information, because everybody on Guam is part of this battle. We're all on the same team, and we all need to work together.